next topic of your syllabus in 4th unit microbiology is collection, handling and transportation of various specimens. So let us discuss about this today. So as you all know, doctor makes diagnosis of diseases in patients by sending some specimens for isolating microorganisms on the basis of the reports of blood and any other specimens. The doctor will be making the diagnosis, final diagnosis, and based on that diagnosis he can determine the treatment modalities. So treatment will be successful only if the right organism is detected. So each and every bacteria and virus, they are responsive to specific antibiotics and antiviral drugs. So it is very important to understand the causative organism which is leading to particular kind of infection in the patients. Unless and until you understand the organism and the causative factor or some cause of the disease, it is impossible to treat the disease properly. It is not useful. So to understand the disease pathology incorrect, so we need to send the specimens for investigation. In hospitals they collect nasal swab, nasopharyngeal swab, oropharyngeal swab, or some specimen from the eyes, ears or throat or gastric lavage, or they collect some specimen of cells, or they collect the pus, or they collect the sputum, or they take stool, so or discharge from the wound, pus. So they send that specimen for investigation to the laboratory. So the lab technician will receive that specimen and he will undertake the study, systematic study of that specimen, and he will determine the particular organism and he will give the report, and the doctor will read the report and he will determine the particular specific chemotherapy, chemical drugs which are useful to treat that infection. He will determine. Then the treatment will be successful. So about that we are going to discuss. You need to collect the specimen. You need to send it to the laboratory, or the laboratory may be there in your hospital, or it may be located somewhere away from your hospital. So in that case, if you take example here now, coronavirus laboratory is there in BIMS, Belgaum. So from Gokak, Chikkodi, and Ramdurg, Munnoli, so all taluka hospitals, they send the specimens RT-PCR, RT-PCR. So that RT-PCR for coronavirus. So to do that investigation, there is a laboratory in BIMS Medical College. So they need to send the specimen. They collect the specimen, they store it in particular container, and they send all the samples together once to the BIMS. So this procedure we are going to discuss. It depends on the particular kind of organism. The procedure differs from organisms to organism, bacteria, virus. So there are many different organisms which are causing diseases in human beings. So what kind of a specimen you are collecting? So based on all that, the procedures are differing. We are going to discuss all that in detail now. So next let us discuss about the specimen containers and their transport. So about the containers where you are going to keep the specimen, that test tube or some bottle is known as a container. Specimen, or it might be a pus, it might be a tissue, or it might be a fluid from the body, or it might be a blood. So whatever, that is known as specimen. And how you are sending it to the laboratory for the study, microbial study. So microbiologist or a lab technician will be doing the study and he will be giving the report. So let us discuss about that specimen containers and their transport here. So you need to use a sterile container so that there is no any contamination apart from the causative organism in the specimen. nothing else should contaminate the specimen. So usual containers, they are of most useful piece of a collecting equipment. So there will be a cotton, calcium alginate, or polyester tipped applicator stick. So you all might have seen how they collect the specimen for corona diagnosis. So there will be a one stick, there will be a cotton tip, and they will insert that stick into your nose or mouth, and they collect the specimen from the nasopharynx or oropharynx. So and then they will keep it in one test tube where there will be a solution, and they will send it to the laboratory for the particular study, RT-PCR. So random antigen test, they do it on the spot. Within 5 minutes, you will get a report. So that is different. So calcium alginate or polyester tipped applicator will be there. There will be a sticks. You need to collect the specimens. So collection of material from throat, nose, eyes, or ear, wound at operative site, or urogenital orifices and rectum. It is done in a Pyrex test tube. So there will be a Pyrex test tube. Size of that test tube will be 20 into 150 mm. So which is a cotton plugged. There will be a plug of cotton. So it will be having an applicator stick also. It is a very small test tube which contains a thioglycolate broth. It contains thioglycolate broth. You can keep the specimen from the throat, nose, eyes, or ear, wound, or operative site, or urogenital orifices or rectal samples. You can keep in a small test tube containing thioglycolate broth. And the swab which is inoculated with the material from the patient, it is placed in that broth tube will be there. That thioglycolate broth will be there in a test tube. In that you will keep the swab which is having a causative organism material. So you will dip into that broth and you will prevent the drying out. So you will not keep it for long period. You will not keep it open. You will close it and you will send it to the laboratory in time without wasting time. So another point here needs to be kept in mind. In case of significant delay, if there is any delay because of unavoidable circumstances, there will be some delay in sending the specimen to the laboratory. In that case, collection of specimen and culturing, transport media needs to be used. A transport media, it will prolong survival of microorganisms. So transport media such as Stewart medium, it will maintain the favorable pH and it will prevent the drying or dehydration of secretions during transport, and even it will avoid the oxidation and enzymatic self-destruction of pathogenic organisms. Enzymatic self-destruction of pathogenic organisms will be prevented by this Stewart medium, and even oxidation is also prevented, and dehydration also can be prevented by this broth. So and then it will maintain the favorable pH to maintain the specimen for long period of time. Another media which can be used is carry and Blair transport medium. So transport medium, carry and Blair. First one was Stewart medium. Second one is carry and Blair transport medium. It is also used for fecal culture actually to isolate Salmonella typhi, which causes typhoid, and Shigella, Vibrio cholera. So to isolate such bacteria, Salmonella typhi, Shigella, and Vibrio, they use carry and Blair transport media. So for anaerobic culture, double stoppered collection tubes are used. So they are gassed out with the oxygen-free carbon dioxide or nitrogen. So inside that tube there will be a nil oxygen, because anaerobic organisms cannot survive in presence of oxygen. So you will remove complete oxygen and there will be a carbon dioxide and there will be a nitrogen and carbon dioxide will be there, and there will not be any oxygen in that test tube. So there will be a tight stopper, means there will be a closure. You will close that opening of the tube. So that is about anaerobic culture. Double stoppered collection tube needs to be used for that anaerobic culture. And then some of the bacteria such as meningococcus in CSF, that is cerebrospinal fluid, they are very sensitive to the low temperature. So they require immediate culturing. So salmonella, that is meningococcus, especially meningococcus, it is a bacteria which can cause meningitis. So you will collect the CSF for study. So because that bacteria which causes meningitis is very sensitive to the low temperature, so that needs to be cultured very immediately without any delay. So on contrary, there will be a clinical material likely to contain abundant microbial flora, so which needs to be kept at 4 degrees centigrade in a refrigerator for several hours. So like urine, feces, so they all needs to be preserved in fridge for viability of most of the pathogens. So in case of any delay, that needs to be carried out. Some of the points to be remembered while collecting the material for microbial examination. If you are collecting some specimen for the microbiological study, you need to keep some points in your mind. So they are: number one, you need to collect the specimen before starting antibiotics or antimicrobial agents. So otherwise, if you are taking the specimen after starting the antibiotics or antimicrobial, you need to instruct to the lab technician. He will take some other measures to do the study of microorganisms in that specimen. So better it is before starting the antibiotics or antimicrobial agents. If you are taking specimen after starting antibiotics and antimicrobials, you need to tell it to the technician, lab technician. And the second point is, so the specimen or material needs to be collected where the suspected organism is most likely to be found. So means you need to collect the specimen or organism or material from the particular point where you can find the organism. Take an example now, to recognize or to do the diagnosis of corona infection, they are collecting the swab from the nasopharynx or oropharynx. Why? Because coronavirus, once it enters through the nose or mouth, so entry is through mouth and nose. So once it enters, it will form the colonization in throat. So if you collect the swab from the throat, you will find that virus. So that's how, where the organism is found, from there, that site you need to collect the material for study, specimen for study. Means if it is a wound, non-healing wound, so if you want to detect the organism causing the pus, you need to collect the pus from the wound. So likewise. And then next is enteric pathogens, especially microorganisms which are causing infections in the gastrointestinal system. They are large or greater in number during acute or diarrheal stage. So you need to collect the specimens during that, because you will find more and more organisms. You can make perfect diagnosis. If you make delay, you cannot recognize the organism and you may miss the diagnosis. And if it is a viral infection of meninges and brain tissue, then you need to take out the cerebrospinal fluid. So you will find the causative organism in CSF, cerebrospinal fluid. So during the onset of the disease, it is better. in the initial stage. If it when the symptoms of acute illness have subsided, you may not find the causative organisms. So that's better when the disease starts in the beginning. You need to take out the CSF for the study. That is third point. Fourth point here it is, specimen should be of a quantity sufficient enough, means not less not more is waste, less is not enough to carry out the diagnosis. So for that purpose, in a sterile container you need to collect the quantity of sufficient enough material for investigation. Sputum, it might be sputum or it might be urine or stool, whatever it might be. So it needs to be in a sufficient quantity. And next is prompt delivery of specimen to be laboratory. So within a specified time period you need to send it to the laboratory without any delay. And then sufficient clinical information you need to supply to the lab technician. So what the doctors will do is they will write the history of the patient, what he is suffering from, all the clinical pictures. They will explain that all in a requisition letter. And then what investigation they needs to perform, that also they will write. So the sufficient clinical information about the patient needs to be given to the lab technician, which will guide him microbiologist in selection of a suitable media, appropriate techniques. So they can determine based on the clinical information of the patient. Doctor needs to provide all that. And then collection of a specimens for anaerobic culture. So they will use a double stoppered collection tube because oxygen may enter. That's why double stoppered collection tube. There will be a special test tubes. So with a double stoppered collection, that needs to be used. So with oxygen free carbon dioxide and nitrogen is recommended. Means double stoppered collection tube with oxygen free carbon dioxide and nitrogen. It is needed for anaerobic culture. So these are all needs to be kept in mind, and some of the points to be kept in mind while collecting the samples from the patient. They are suspected to have anaerobic infection. So there are some special points to be kept in mind while you are collecting a specimen from the patient. To have anaerobic infection means anaerobic organism is causing an infection in a patient. You are collecting the specimen from that patient. In that case you need to keep some of the points in mind. So these are, you need to avoid the contamination with the normal flora. So normal flora means some of the bacteria which are present normally on your skin, on your body, or around the mouth or inside the mouth. Likewise, you should avoid the contamination with the normal flora. Whatever the specimen you are collecting, you should not touch it with the normal flora of the body, and avoid contact with the oxygen. So you should not allow the specimen to come in contact with the oxygen. And then you should not refrigerate the samples. So you should not keep the sample in a refrigeration. So anaerobic infection specimens for anaerobic infection need not be refrigerated. Means you need to send the collection immediately to the laboratory, and the lab technician or microbiologist, they need to process the specimen immediately. And then transport media should be used only when there is a delay. So transport media can safeguard the material for long period of time. It needs to be used only if there is any delay in transferring the specimen to the laboratory. So these are all some of the points to be kept in mind while collecting sample from the patient. Next, let us discuss about handling of a specimen in the laboratory. So you have collected the specimen and you have sent it to the laboratory. So that is all there. And after reaching the laboratory, so lab technicians and microbiologists, they are very busy with their work, and it is not always possible to inoculate the specimen then and there itself when it reaches the laboratory. So most of the times what happens is they keep it in a refrigerator at a temperature of 4 degrees centigrade to 6 degrees centigrade for a safe and reliable method for storing. So they keep it in fridge at a temperature of 4 degrees centigrade to 6 degrees centigrade. So urine specimens for culture, it can be kept in fridge for 24 to 48 hours. Organism will not die, means you can do the study within 24 to 48 hours. And swabs from the wound, urogenital tract, throat, rectum, and feces and sputum, they also can be kept in a fridge for around 24 to 48 hours. You can keep in a refrigerator. And then even gastric washings and resected lung tissue for the culture of Mycobacterium tuberculosis needs to be processed immediately without any delay, because tubercle bacilli, it is very sensitive and it will die rapidly. So in the specimens, so you cannot recognize it and study will fail in making the diagnosis. That's why the gastric washings or resected lung tissues for culture of Mycobacterium tuberculi, you need to process it immediately without any delay. And the sputum, bronchial secretions, bone marrow, purulent materials from the patient suspected having a systemic fungal infections, they needs to be inoculated as soon as possible. For a fungal infection, systemic fungal infection, the specimens collected from the patient, that is sputum, bronchial secretions, bone marrow, or purulent material from the patient, they needs to be processed, inoculated as early as possible without any delay. So and then next is pieces of hair, scrapings from the skin, nail, which are submitted to the laboratory for a fungal culture. You can keep it at a room temperature for several days before inoculation. There is no problem. So there will nothing will happen for skin scrapings, nails, and hair for fungal culture. If they have sent it for fungal culture, you can keep at a room temperature only. No need to keep in fridge. And the specimens which are submitted for isolation of a virus, they needs to be frozen immediately. They need to be kept in a freezer. And specimens of clotted blood for a virology study. So to study virus in the blood, if they are sending you the blood, clotted blood, you can keep it in a fridge. You should not keep in a freezer, but you can keep it in a fridge inside at a temperature of 4 to 6 degrees centigrade. So if it is for virological study, clotted blood for virological study, you can keep it in fridge. And specimen which is submitted for virus, it needs to be frozen immediately. So if it is specimen, clotted blood, you can keep it in a fridge, not freezer. So this is about handling of specimen in the laboratory. So that's it about this topic.